Thanks a lot for joining us on Gist Nigeria from the BBC and Channels TV, where we bring you fresh perspectives to stories being shared and liked on social media. I am Wali Fakile. Let's kick off with our top story for this week. With over 6,000 confirmed cases of coronavirus in the country, containing the virus is a primary concern for health authorities. However, it seems that other ailments with higher death rates than COVID-19 have been overlooked. In this story, Gist Nigeria's Ajoke Uluote tells us why some hospitals have put restrictions in place for patients and what this could mean for public health.
The coronavirus pandemic continues to change the world as we know it. Globally, about 4.5 million cases have been confirmed and over 300,000 deaths recorded. COVID-19 is pushing healthcare systems to breaking points and leaving countries with inadequate facilities grappling with more emergencies. A 2019 ranking of global healthcare systems by the World Health Organization rates Nigeria 187 of 190 countries. This could suggest most people have limited access to healthcare. With more than 6,000 confirmed cases of the virus and lockdowns in some cities across the country, Nigeria, like most countries, continues to grapple with new realities. Although containing the COVID-19 pandemic remains a priority, other health needs of Nigerians may have been left to suffer. Some people with pre-existing ailments have complained of neglect and limited access to health care. Alagbo Unwachukwu's wife, a mother of 4 children, was diagnosed with hypertension and was rushed to the emergency unit of the University of Nigeria Teaching Hospital, Enugu. He claims the doctors on duty refused her treatment.
I now called the female doctor there. Please, can you help me attend to my wife? This is a mother of 4. And she's my wife. That is going down by the minute. Please, I know you are a mother. And you know what it means to lose a wife and a mother. Please attend to her. And the woman told me, if I were to be her brother, will I tell her to go and touch this woman and die? The doctor that sent us for tests kept on calling these people, and he gave the doctor on ground on emergency phone. The doctor was like harassing the man, and was telling him that you are my fellow doctor, you're supposed not to be talking to me in this manner. The doctor was just telling you just do your job and save this woman. I know her. Her problem is just BP. Just give her a little aid. The woman will come back normal. And this doctor refused until my wife gave up inside the car.
We reached out to authorities at the University of Nigeria Teaching Hospital, but they refused to comment. Just like Alagbo, Benjamin lost a sister who had been diagnosed with cancer and was receiving treatment at the Lagos University Teaching Hospital before government imposed the lockdown. He shares his experiences with me.
Unfortunately, during this lockdown period, access to health facility became so tedious. Immediately after the easing of the lockdown, they had to scheduling me. That was for Thursday. And on Thursday when they went, unfortunately for her, maybe the cancer have eaten so deep, those period of no treatment. Around that period, few hours, it was so unfortunate. She passed away.
Alagbo and Benjamin could be described as the victims of the failure of the Nigerian health system. They are concerned by what they describe as a denial of a person's basic right to health care, and in worst cases, preventable deaths.
Even if it's COVID-19, can't they attend to her? Don't they have PPE and all these things? So if somebody is even COVID-19 patient, they will leave her to just die like that.
Every effort to reach them in loot proved abortive. There wasn't any immediate solution for us to come. So if she had gotten that health care, as at when due, sincerely the tendency is there. The tendency is there that she could survive.
Lanre Adeyemo is the chairman medical advisory committee at LUT. He says the challenges of COVID-19 and lockdowns may have forced the hospital to reorganize its activities, but insists LUT's vital operations have been intact.
Both has a world-class cancer center, NFCC, and that center has now closed down for a day. Maybe because of the lockdown and some issues associated with it, maybe the patient came late before we could gather this and that. Patient couldn't survive. But like I said, it's quite unfortunate. But I am aware that we hope.
With widespread fears of infection and hospitals limiting services to emergencies, thereby turning some patients away, the fate of many living with other forms of life-threatening diseases continues to hang in the balance.
Many of the clinics have been scaled down. Many of the interaction with patients has been reduced, and also many of the patients that would have been admitted have been carefully selected so that we do not have getting our bed space crowded.
Meanwhile, the Nigerian Medical Association insists lack of access to personal protective equipment and adequate insurance cover for its members on the front line could mean access to public health care may remain limited.
If we have health workers and doctors staying at their duty posts, it means they are ready to take care of patients coming into their facility. Unfortunately, if they don't have such protective equipment, I'm afraid it may be difficult for you to ask them to go and risk their life.
With health workers refusing to risk their lives, what alternatives do authorities have to bridge the gap?
We do understand that it's not only desirable, it is compulsory for us to make PPEs available to particularly the frontline workers in our various hospitals, and that is being addressed, and that much I can tell you, because we continue to engage with the leadership of the NMA and of course other health workers in Juhesu and that is Joint Health Workers Union. We do engage them and try to address all these issues.
The need to restore confidence to an already wary team of health workers and address limitations to healthcare should become a priority for everyone. This would help prevent a bigger health crisis that could see the country lose more people compared to the COVID-19 death toll. Ajoke Hulotse, Gist Nigeria.